I want to welcome everybody to this webinar today, Understanding Anxiety Disorders. And it's a really, really important topic. I know that all of you are dealing with anxiety and anxiety disorders and mental health in many of your programs. And it'd be helpful to have some of this information. I think this is really at the beginning of the conversation, and we hopefully will continue to carry on this conversation over the next few years and really help everyone gain a greater understanding about how your programs can help with mental wellness and mental illness, not to be clinicians, but to know, to be the identifier oftentimes and help kids find the services and resources that they need, and then also provide the support. So as we go through the webinar today, you can type in the question boxes, you can type your questions. We're going to hold questions to a few points throughout the webinar, but my colleagues Karen Campbell and Kasia Ignatowska are going to collect the questions. Sometimes they'll be the same, so they'll collect the questions and then read them out for our presenter at a couple points throughout the webinar. The other thing I want to mention is that if you click on in your panel, there's something that says handouts. If you click on that, the PowerPoint slides are there as a handout. You can click on that, the name of the PowerPoint, and you can download it onto your computer, so you don't have to take massive notes. That PowerPoint is there for you. We're also going to do a couple polls during the presentation, and so the polls will pop up on your screen, and you click right on the screen to answer your questions, and then we'll be able to see what the results are. Okay, so those are the few things just wanted to mention before we get started. So it's interesting because I'm right now at a conference in London, Ontario, and the conference is around healthy relationships, and it's talking about the links between mental health and violence. So it kind of seems appropriate that we're having this conversation today. So it's my pleasure to introduce Dr. Sunita Manga. She is connected to both Sick Kids Hospital in Toronto, Ontario, as well as the University of Toronto. So I want to pass it over to her and thank her and welcome her to our webinar today.
Thank you, Beth. Thanks very much for having me here. I think talking about anxiety is such an important topic. And I just clicked a slide and did my presentation go away? Hello?
Yep, 1 second,
yeah.
We're just...
So anyways, if you can move the slides forward, I can keep talking, but the slides have disappeared on me. So I just kind of...
Sorry, Sunita, we'll just sort... Karen, do you want to take it? Do you want me to take that back? Yeah, I'll do...
Yeah, sorry about that. I'll just get it up on the screen for us. 1 second.
No problem. So I'm just going to keep moving forward because the first few slides are not really important. Now, if I click here, will it work for me?
I'm just going to give you the controls right now and try it now. You should be able to.
By clicking enter, right?
Yep, just click your mouse right on the screen and you should be able to do it. There you go.
Okay, perfect. Thank you. Sorry about that confusion. So I actually just wanted to mention that I do have some research funding. That was the slide that didn't pop up for very long, and that today I'm hoping that we can talk enough about anxiety disorders so that you have a good understanding about the difference between just feeling anxious or stressed out and actually having an anxiety disorder. I'm hoping that we can talk a little bit about the signs and symptoms of common anxiety disorders that present in kids and teens, and just very briefly talk a little bit about treatment approaches. So the first question, can you take that back? I don't know how to take it back. And thank you. So the first thing I wanted to do was just ask all of you to think about whether you've ever experienced a time where you just felt butterflies in your stomach before a big presentation, or you had to run to the bathroom before an interview, or you felt a little uncomfortable before meeting someone you didn't know very well, or you felt your heart beat fast when you saw the lights on at home, and you were sure you'd turn them off before going away from the home. So just kind of click yes or no, and we'll see what happens. So do we have...
Okay, I'm going to close the poll now. Oh, sorry, I maybe closed it too early, and I'm going to share the results.
Okay, so I'm glad to see that many people kind of at least identified with one of those symptoms, and several of you identified with all of those symptoms. So we all do feel anxious from time to time, and those are all common symptoms of anxiety. So it's perfectly normal to feel anxious from time to time, but when your anxiety interferes in your day-to-day functioning, that's when we call it a disorder. So some anxiety is normal and beneficial. It's actually helpful to have a little anxiety before you write a test, because that pushes you to study harder. But when the anxiety interferes in our day-to-day functioning, that's when we call it a disorder. And that's what we're going to spend a few minutes talking about. So as I've said several times already, when the anxiety interferes in your day-to-day functioning, that's when you call it a disorder. So if you feel a bit anxious before a presentation, but you can push yourself to do it, you don't have an anxiety disorder. So how do we classify anxiety in teens and children? So when the anxiety prevents a child from getting to school, or demonstrating what they know academically, or prevents them from making friends or doing things that would be age appropriate, then we will have to consider an anxiety disorder. Unfortunately, anxious kids tend to be quiet. They don't cause a lot of fuss at school or in other programs. They tend to worry a lot, and they don't kind of voice those worries. So many times, kids with anxiety don't get recognized. Sometimes with little kids, kids can have a temper tantrum because they're feeling so anxious in a new setting, and so they get labeled as having a behavioral problem rather than an anxiety problem. So it's important to know about anxiety and anxiety disorders so that you can recognize when a child might be having an anxiety disorder. So it's also important to know that stress doesn't mean you have an anxiety disorder. As I said, a little anxiety is actually beneficial. The other complicating factor is that many kids have periods of feeling anxious that would be totally normal. For example, many 3 and 4-year-old kids might be fearful of the dark, and if that's a worry for a couple of weeks or maybe a month or two, and it doesn't really interfere in their day-to-day functioning, we wouldn't call that a disorder. So in the last 10, 15 years, we started to really recognize that kids can have an anxiety disorder, because in the past, many clinicians would say, oh, kids can't have anxiety disorders. What do they have to worry? That's a disorder that you have as an adult. But now we know that many, many kids have an anxiety disorder, and it's important to recognize that. So what causes an anxiety disorder? We actually don't know, but the best model to think about is it's kind of like diabetes or allergies. You kind of have a genetic component, meaning there's something in your genes, and then there's a temperament component, meaning that just your personality or your makeup of how you view things may be a contributor, but also modeling. So if your parents are very anxious and they model very anxious coping strategies, that may influence the anxiety. And then, of course, if you do have a stress, so if you have all these vulnerabilities and then something kind of traumatic happens, that might lead to an anxiety disorder. But you have to have some or all of these together to actually cause an anxiety disorder. And as I've mentioned, that's when the anxiety prevents you from doing something that you should be able to do. Okay. So as I mentioned already, there are some developmental concerns. There are certain things that babies are fearful of, and we wouldn't call them having an anxiety disorder if these symptoms were circumscribed, were not too interfering, were not happening for too long. So with babies, loud noises, being startled, knowing this is mom and that's not mom, that's a stranger. These are all normative fears. With toddlers, like 2, 3, 4-year-olds, many kids go through a period where they're worried about monsters under the bed or in the closet. They don't like the dark. They may not like to go to school because they don't want to be away from mom or dad or another caregiver. School-age kids, many of them like 6, 7, 8 years of age, may start to realize the world's a big, scary place. They may worry about getting hurt. They may start to worry about thunderstorms or lightning storms or tornadoes and become quite preoccupied with those for a short time. And that would be totally normative. With older kids and adolescents, many teens start to worry about, whether other kids like them, whether they're doing well at school, whether they're, fitting in. And again, those could be normative fears, but if they start to interfere or last too long, then of course you have to think about an anxiety disorder. Some symptoms of anxiety are some of the kind of red flags, if you will, are when you see kids who are really shy or quiet or overly cautious, or if a child or teen keeps asking a whole bunch of, well, what if this happens, or what if that happens, and they just can't kind of get any reassurance. Stomach aches, headaches, I don't feel well, my muscles hurt, those could be symptoms of an anxiety disorder. Anxious kids often can't fall asleep because they're worrying about things, or they may have a disruptive sleep, or they may have nightmares. So ask about how they're sleeping. Many anxious kids have a hard time separating. They don't like new situations. They're excited to go to the birthday party, but once they get there, it's overwhelming for them, and they have a temper tantrum or they want to leave. Many anxious kids are very fussy or picky about what they will and won't eat. They may have difficulty trying a new thing. Many kids with anxiety can look depressed. They can be quite moody or irritable. But depression is not common in those who are younger than 12 or 13 years of age. So if you see a lot of moodiness, in a 10-year-old, you want to think anxiety first. Of course, they could too have depression, but you think anxiety first. Many of these kids need a lot of reassurance. They may be restless or have a lot of tension in their body. They're very sensitive to criticism. So you say something, they take it to heart. They can't let go of that comment. And many can be quite perfectionistic or very rule-oriented. Now, none of these are diagnostic, but these are kind of red flags that if you see a lot of these symptoms, you may want to think about whether a child has anxiety. So anxiety disorders are the most common childhood, adolescent psychiatric condition. 1 in 10 kids or teens will actually have an anxiety disorder. So in a typical classroom of 20 or 30 kids, you've got 2 or 3 kids with an anxiety disorder. The other thing about anxiety is that they're very highly comorbid, meaning that a child with one anxiety disorder more than likely to have more than one anxiety disorder. The statistics are 40%, but in many of the studies that we've done, 60 to 70% of the kids we see in our clinic will have more than one anxiety disorder. And the more severe the anxiety, the greater the impairment, the more likely it's going to persist. Anxiety disorders don't go away without treatment. They need to be recognized, they need to be treated. I'm very quickly going to go through the different types of anxiety disorders, and then we'll pause for questions. We define the different types of anxiety disorders based on what the main fear or worry is. So with a specific phobia, for example, a specific phobia of spiders, the child or teen is deathly afraid of seeing spiders. But you could have a specific phobia of heights. Separation anxiety disorder is a worry where the child or teen is thinking something bad might happen to them, or something bad might happen to their mom or dad or primary caregiver when they're not together. And that's why they're so reluctant to separate. But the worry is that something bad might happen to them or their parent. Generalized anxiety disorder is this kind of catch-all. You have to think of these kids, as being worrywarts. They worry about many, many different things. So I've seen 8- and 9-year-old children who are worrying about, whether they're ever going to get a job, whether they're ever going to get married, and you kind of can't even fathom how they could be thinking so far ahead in the future and worrying so much. Social anxiety disorder, here the main worry is that you might do something silly or embarrassing in front of others, or others will laugh at you. And a new diagnosis is selective mutism. And many of us believe that selective mutism is kind of a more developmentally severe form of social anxiety disorder. So in selective mutism, most common in little kids, the child is so anxious they're unable to speak in a variety of settings, although their speech and language is perfectly normal. At home, they're loud, they're boisterous, they talk comfortably, but bring in a new person or get them in front of a teacher and they stop talking. Panic attacks, this is a cluster of 4 symptoms, kind of those symptoms that I showed up at the beginning, your heart pounding, you have to go to the bathroom, you think you're going to die, you feel dizzy, you feel hot, cold. 4 symptoms together out of the blue means you're having a panic attack. But all these anxiety symptoms can be associated with any of the other anxiety disorders. But when you have recurring panic attacks, and then you start to worry about having the next panic attack, that's panic disorder. So we're going to stop here for a moment and have a cartoon up there for people to read. And if there are any questions that people would like answered at this point in time, we can do that.
Okay, thank you. We don't have any questions written in the box yet, but if people want to take a second while you're reading the cartoon and type in any questions that you have, maybe I'll ask one question while people are having a chance to type. I'm wondering about the types of anxiety disorders. Is there differences in terms of ages where you've seen some of these? Like, is it more likely that it would be older children where you might see the generalized anxiety disorder, or is it, could be quite young as well?
So you can see all of the anxiety disorders in any age range. Selective mutism is one where you tend to see it in younger kids, and panic disorder is one where you tend to see it in older adolescents. But you can have a 5-year-old with generalized anxiety disorder, and you can have a 14-year-old with separation anxiety disorder. So all of the anxiety disorders can happen in any age.
Okay, great, thanks. So we don't have any other questions right now, so maybe we'll just move on to the next slide then.
Perfect. Okay, so I don't know what happened. Oh, there it is. So I thought we should just talk briefly about a formal diagnosis of anxiety. So if a child is referred to a psychiatrist or a psychologist or a social worker and has a formal assessment, typically that means they are meeting with a mental health professional. Typically, both parents and the child are interviewed. Here in our clinic and in most clinics, we would spend time with the family together to kind of get everyone's viewpoints, and then sometime with the parents alone to get their viewpoints, and definitely sometime alone with the child or teen. Many parents don't recognize anxiety in their kids, and so it's very, very important to spend time with the child or teen by themselves. There are a number of really good self-report instruments. So these are questionnaires that kids older than 8 can fill out, and it gets at many anxiety symptoms, and that's a good way that a clinician can ask around and ask for more details. None of these, however, are diagnostic. So just because someone completes a SCARED, which is the screen for child anxiety related emotional disorders, and scores above the cutoff point of 25 doesn't mean they have an anxiety disorder, but they're helpful instruments. The MASC is the multidimensional anxiety scale for children. The CDI is the Children's Depression Inventory. And many kids with anxiety, especially in teenage years, may also have depression. So you do want to screen for depression. But a clinician doing an assessment is going to ask a lot about what's happening at home, and what's happening at school, and what's happening with friends. And they're going to try and get at what symptoms bring on the anxiety, what things exacerbate the anxiety, and also how much distress or impairment is happening. A good psychiatric assessment needs to look at what else is going on in the child or teen's life. Are there things happening at home that are causing significant stress? And that is the main anxiety factor. So if mom and dad are having a divorce, a very acrimonious divorce, fighting all the time, maybe the child's just feeling very anxious because of all that, and may not have an anxiety disorder. They may also have an anxiety disorder, but you want to look at things from different lenses. Or a child who's at school and being bullied or teased, that could be the kind of factor that needs to be addressed to help their anxiety. A good psychiatric assessment involves asking about what medicines a child might be taking, because some medications can cause anxiety. Drinking too much coffee can make your heart pound faster than it should. That could be a contributor to the anxiety symptoms. It's very important to do a developmental history and see when the anxiety might have started, what other things might be going on, for example, learning issues or school or academic difficulties. And then, as I said in one of those slides with the turtle, anxiety disorders run in families. There's a genetic component, so you want to do a good investigation about family history. Is anyone else got an anxiety disorder? It also makes it an important thing to look into, especially where perhaps mom is modeling a lot of anxiety coping, and that's why the child's feeling so anxious, and the child may not have an anxiety disorder and just needs mom to have some understanding of how she is kind of modeling a lot of anxiety. So anxious kids have a lot of have a lot of common comorbidities. So what I mean by this is other disorders often tend to run together with anxiety. So I've already talked to you a little bit about how if you have one anxiety disorder, for example, separation anxiety disorder, a child will also very likely have another anxiety disorder, for example, generalized anxiety disorder. But oppositional defiant disorder or attention deficit hyperactivity disorder or a learning disorder are also common disorders that run together, if you will, with anxiety. When you get into the teen years, you have to think about, could this teen also have depression? Or are they utilizing a lot of substances because they're so anxious, self-medicating, and now have a substance use disorder? And when you do a good assessment, you want to look at any other diagnoses a child or teen might have. And then treatment planning starts with what symptoms or what disorder should I target first. So for example, a child who has a lot of ADHD, can't pay attention, can't focus, that may need to be treated first before you start treatment for the anxiety, because the child or teen might not even be able to focus long enough to take in the therapy. So DSM-5 is the Diagnostic Statistical Manual. Many of you might have heard of this. This is a big textbook that kind of identifies the criterion for each disorder. And there have been numerous iterations, and the latest one was DSM-5, and it had a number of changes, and I'll just quickly go through them. But selective mutism finally came under the umbrella of an anxiety disorder. I've already talked to you about what selective mutism is. It used to be not within the umbrella of anxiety disorders. Obsessive-compulsive disorder, however, where you might have an obsession about something and then you do some act compulsively, for example, a worry about contamination and then you wash your hands repeatedly, no longer is considered an anxiety disorder, and it's moved into its own class of disorders. And then post-traumatic stress disorder also has moved out of the umbrella of anxiety disorders and into its own diagnostic category. So that's where you have a traumatic event and then you have a whole bunch of anxiety-like symptoms. So we're going to move on to treatment. I think treatment, from my viewpoint, involves a three-step treatment plan. So, I mean, you do need a good diagnosis. You then want to talk to the child and family about what anxiety is, what an anxiety disorder is, and then psychotherapy or talk therapy can be very, very effective. And we're going to spend a few minutes talking about cognitive behavioral therapy. And sometimes medications are necessary and important to utilize, and we'll briefly touch upon medications. So treatment of anxiety disorders, you want to have a good psychiatric or psychological assessment. You want to have a diagnosis. As I mentioned, many kids might have other diagnoses. So you want to rule in and rule out other possible diagnoses, for example, depression or ADHD. You want to then provide some education about anxiety versus anxiety disorders. You want parents to understand and teens and kids to understand that without treatment, anxiety doesn't go away. If you're feeling stressed, that gets better with time. Or if you have a few anxiety symptoms, that sometimes can get better with time. But if you actually have a disorder, it's not going to get better with time. And untreated anxiety disorders can morph into depression. I've alluded to them morphing into substance use problems. The teenager who feels really, really anxious about meeting new people, goes to a party, drinks a lot to feel comfortable, and that over time morphs into a substance use problem, in addition to the anxiety. So we're going to talk very briefly about what cognitive behavior therapy is, or CBT. It is a very, very effective treatment. Numerous studies have been done from about CBT, and it's been proven to be a good treatment for kids and teens with anxiety. Essentially, you're doing some talk therapy where you're helping kids recognize the connection between their feelings, their thoughts, and their behaviors. So the first step is to teach them to recognize their feeling states, recognize when they're feeling anxious. So going back to that very first slide, oh gee, when my heart's pounding and I can't breathe, or my tummy feels like it has butterflies in it, I'm feeling anxious. So help kids recognize when they're feeling anxious and feeling other feeling states, then teaching them some relaxation strategies, and then some cognitive strategies. So this is the cognitive triad, or the connection between our thoughts, our feelings, and our behaviors. So anxious kids, they often automatically think, oh, I'm scared, I can't do it, or things like, if I'm not perfect, there is no point. They often think of the world as a very scary place. They think the future is uncertain or scary, and it's these automatic thoughts that come to their brain. So when they are faced with a new situation, they automatically think, I can't do this. And then the whole process of CBT is to first recognize that they're feeling anxious, teach them to calm themselves down, and then look at that thought, I can't do it. Is that actually true? Challenging those thoughts, helping them recognize that perhaps that's not a realistic thought, that's not a helpful thought, and then problem solving to look at more adaptive thoughts. That's the premise of CBT, and we can talk more about that if we have time or if people have questions. But essentially, it's our thoughts that make us feel anxious, and then because we're feeling anxious, we think more anxious thoughts, and we go round and round in this kind of vicious cycle. And CBT puts a stop sign there and says, stop thinking those anxious thoughts. Let's figure out and think of a better or more realistic thought. Sometimes we do use medications. Medications actually, in a big study, the CAMS study, or the Child Anxiety Multimodal Study, demonstrated that the combination of CBT and medications is actually the most evidence-based treatment for an anxiety disorder in kids between the ages of 7 and 17. However, many parents are reluctant to start at medications right off the bat, and given the strong evidence for CBT, many clinicians will start with CBT, and then if things don't improve, move on to adding medications. The kind of medications we use are called the serotonin selective reuptake inhibitors, or you may have heard the term SSRIs. Common medications include Prozac, so you may have heard the use of things like Prozac or Zoloft. So it's really important when you think about anxiety is to make sure nothing else is going on. So I've touched upon this, but I think this diagram demonstrates it quite nicely. If you're a child with a learning disorder and no one's recognized that, and you're struggling at school, you're going to feel anxious. If you are being bullied, you're going to feel anxious. And then just being and feeling anxious makes these things worse. And so you have this other cycle going on. When you have a lot of these symptoms causing the anxiety, doing CBT or using medications is not going to be helpful until you actually address the learning issue or the bullying. And so it's really, really important. This is a bit of my own pet peeve, that you look for these other things, you treat or kind of rectify as best you can these other things before jumping to just treating the anxiety. So I'm going to talk a little bit about ways that you, as frontline workers who see these kids all the time, can be helpful, even if the child or teen hasn't received a diagnosis. It's important to recognize the anxiety as a symptom. It's important to provide gentle but firm reassurance and encouragement. It's also important to recognize when the child is being brave. We teach our parents that are in treatment for their child's anxiety to recognize the brave moments. Don't just focus on the anxious moments. Kids with anxiety, they like structure, they like routine. Help reframe things positively. See if you can get at that negative or anxious thought and reframe it in a positive way. Anxious kids sometimes have a hard time making friends. Think about, introducing a buddy, or how you're having a child, like, pairing up kids to sit next to each other. Complement the process, not just the product. And always remember that you want to reward attempts at being brave, even if they're not successful. And one-on-one chatting is just helpful sometimes. If you're a teacher and you're at school, kids with anxiety can be perfectionistic. They don't let go of things. They have to do things over and over again. So set a limit for, you got to just do the best you can in 15 minutes. Or allow a child to take a time out if need be, or just give them one sheet of work at a time. We call progressive desensitization building ladders, and so helping kids build a ladder of steps that they can take from being scared or nervous to being brave. We don't advocate for homeschooling. We think that kids with anxiety have to learn to face their fears, and so if they're feeling anxious at school and don't want to go to school, we think keeping them at home and fostering that is not helpful. But building a ladder of how they can get back to school in small steps, maybe being in the library before coming into the classroom, is useful. Building ladders is very helpful with kids who don't speak because of their anxiety. If you have a child, or you see a child with selective mutism, you don't want to label them as the non-talker. You don't want other kids to talk on their behalf. You always want to set the expectation for speech. So we've come to our final question from me, and then I think we'll have time to answer your questions. And I'd like you to think of which of the following statements, based on what I've talked about today, is not true. Anxiety disorders are the most common psychiatric disorder seen in children and adolescents. Anxiety disorders improve with time. Feeling anxious is not the same as having an anxiety disorder. When anxiety symptoms start to interfere in a child's day-to-day functioning, it's time to look at what else is going on and consider whether a referral to a mental health agency is necessary. And anxiety disorders tend to run in families. I'll give you a moment or two to take a stab at that.
All right, I think we're going to close the poll in a minute. There's just a couple more people who might want to vote. Most people have, so I'm going to close the poll now, and then we'll share the results.
Okay, so you guys are wonderful. Anxiety disorders improve with time. That's not true. Anxiety disorders don't improve with time. They need to be recognized, they need to be identified, they need to be diagnosed, and they need treatment. Anxiety symptoms or normative developmental fears can get better over a few weeks, but an anxiety disorder does not get better with time. Okay. So, important takeaways, and then we'll open it up for questions. I hope you've recognized that the distinction between kind of feeling a bit anxious and an anxiety and having an anxiety disorder is a bit gray. But when the anxiety is interfering, that means it's a disorder. Um, Things to think about when you see kids who might be anxious with signs and symptoms of anxiety. How much are those interfering in the teen or child's functioning compared to same age peers? Are there other things going on? And if there are, see if you can rectify bullying or learning issues or other school stressors. And if you suspect an anxiety disorder, I think it's important to talk to parents or talk to the teen and say, you know, I'm worried about this. I think there may be an underlying anxiety disorder. Maybe going to see your family doctor or pediatrician as a first step might be helpful. And then they can decide whether you need a referral to a anxiety clinic or a psychiatrist or something like that. And here are some helpful resources for you to look at if you're interested in knowing more about anxiety disorders. Keys to Parenting Your Anxious Child is a fabulous book for parents, but for people who are working with kids, it just gives a good overview of what anxiety is and what an anxiety disorder is, and how to assess it and think about it and do some good interventions at home or at school. What to Do When You Worry Too Much is a lovely book for kind of kids under 12 or 13. It's a kind of a self-help workbook, and parents can do it with their kids, or older kids can do it on their own. And Raising Your Spirited Child is also another nice book that talks about kind of the temperamental piece of anxiety. And so now we're going to pause, and I think we have time for a lot of questions if anyone has any.
That's great. So my colleague Kasia is going to read out some of the questions that have been sent typed in already. So as we're answering these questions, please feel free to type more questions because we have some time, and we can also, as the responses are coming in, you may think of other things. So I'm going to turn it over to Kasia, and she's going to read out some of the questions.
Hi, so we have a couple of questions from Alexandra. The first one is, how do you respond to kids who are maybe experiencing selective mutism versus kids who are shy? Can you tell the difference necessarily?
Yeah, that's a great question. So, selective mutism is when kids just kind of can't speak for a long time period. So, shy kids may, in the first month of school, be quite shy and quiet. They may not talk. And so, we never diagnose selective mutism if a child hasn't been talking for the first month of school. They have to be not talking for longer time periods. But the best thing to do is kind of look at how long or a warm-up time a child needs before they start speaking. So, so an example would be a child who's 6 in grade 1 for the first time. Kind of early October they start talking. That would be more in the realm of shyness. But the child with selective mutism is January and the child still hasn't talked. So it's hard, and sometimes you're better off giving it some time to see what happens, but then having a professional do an assessment.
Okay, and thank you. So the second question is, what are the ways that responding to anxiety in children significantly differs from responding to adults with anxiety?
I actually don't think that it differs that much. It's just kind of the the approach you would take is you have to kind of keep in mind the developmental age of the child. So the way you talk about anxiety with an 8-year-old is going to be different than the way you talk about anxiety with an 11-year-old, which is going to be different than the way you talk about anxiety with a 13 or 14-year-old. And that's going to be different than the way you talk about anxiety with an adult. So it's kind of, using the kind of language you would use with that age range, and then talking about anxiety and explaining what anxiety is using that developmental framework. So I don't think there are big differences. It's just kind of using the choice of words that would be developmentally appropriate.
Thank you, Sunita. So another question from Sala. 1 out of 10 kids have anxiety disorder, so it's not common. So it's not a common disorder, right?
No, it's a very common disorder. That's 10%. That's most other psychiatric disorders are much lower. So 1 in 10 may not sound like a lot, but is seen as a high number. So 10% of kids will have an anxiety disorder. It's the most common psychiatric disorder, more common than behavioral disorders in children and adolescents. For example, selective mutism, 0.7 to 2% of kids will have selective mutism.
Okay, thank you. So another question from Tara. If we had a participant in the program who was having an anxiety attack, what is the best way as a facilitator to help the participant handle the attack in program without singling the child out in front of the rest of the group?
Now that's a tough question, but if you could possibly, without, say, hey, why don't we all try to do some deep breathing and relax and like relaxation strategies are really the best to kind of bring down a panic attack. The problem, though, is that if the anxiety is kind of at a point where they're hyperventilating and really having a panic attack, it's almost too late to use relaxation strategies. So I'm not sure how you could bring down their anxiety without kind of helping them without singling them out if they're in the midst of a panic attack. Because you really want to have them come out of the room, come out of this stressful situation, and kind of have quietness and help them do some deep breathing and calm down if they're in the middle of a panic attack. If they're kind of just starting to feel anxious, you could just kind of have everyone try some relaxation strategies and see if that helps. But it's not very easy to do that without kind of signaling them out. I'm not quite sure if I can answer that in any better way than that.
Thank you. And we have another question from Sala, who would like another example regarding the latter approach.
Does Sala have a situation that we could use? I would be happy to talk about a ladder approach, or I could come up with one.
Well, we could turn his microphone on, Sal, if you want to ask, and we'll see if that helps. So Sal, I've turned your microphone on. I don't know if you hopefully you have a microphone on your computer, and we'll just see if you do. Is there anything that you can elaborate a little bit more on your question?
Well,
okay,
so that's fine. So ladders can be done with many different fears or phobias. So if we were to use a fear of dogs, you would start with looking at So building a ladder is getting input from the child as well as your input as a therapist about what they might be feeling fearful of. So you want to spend time saying, well, are you afraid of big dogs only, or all dogs, or black dogs, or certain kinds of dogs? You want to build a ladder that way by kind of identifying what kinds of dogs might be lower down on a ladder, what kinds of dogs might be higher up on a ladder. If someone had a fear of all dogs, maybe the first step would be to just look at pictures of a dog, and you have to conjointly teach them how to do some good relaxation strategies so that as their anxiety rises, as they're looking at pictures of a dog, they can calm themselves down. And you only move up to the next step on a ladder when they can look at a picture, for example, of a dog and not feel overwhelmingly anxious. So looking at pictures of a dog, then maybe seeing a dog from 100 meters away, and then kind of getting closer and closer to the dog, or going to the pet store and seeing a dog behind a window. These could all be different types of steps on a ladder for fear of dogs. Basically, with a ladder, you're breaking a big worry or fear into several, 5, 6, 7 steps. And with each step being a little bit more anxiety provoking than the previous one. And that's why you need the input from the child or teen you're working with to kind of gauge what those steps would look like.
Thank you, Sunita. So Sala is typing out thank you, which looks like you've answered his question.
Great.
So thank you for that. And that it looks like at this point this is our last question.
Okay.
All right. So we're just going to wrap up then. So, I wanted to thank Sunita, unless there's something, Sunita, that you wanted to just add before we wrap up. Didn't want to
No,
cut you
I
off.
mean, I hope this has been helpful for everyone. I mean, I think anxiety is one of these conditions that, people don't often recognize, and yet they're so common, and it's important for us to be more aware about anxiety in kids and teens.
Great. Thank you so much. It was really helpful. It was a great foundation on the whole topic of anxiety and anxiety disorders. And I think it's, provides some clarity as we're working with kids, and it will help us know when to take another step, or also think about some strategies that we can help kids in our programs. So we really appreciate your time. This, as I said at the beginning, I'm sure this is just the beginning of the conversation, and hopefully we'll have opportunities among this group of grantees to continue the conversation and talk about some practical strategies in our programs. So we will be sending out the recording of this webinar. I forgot to send out the January recording, so January webinar recording, so I'll do both at the same time. Probably be tomorrow that it's sent out. So if you have any other thoughts, please don't hesitate to email me, or if you have some specific things that you'd like to have further conversations on, please go ahead and email me. And once again, I want to thank you, Sunita, for sharing your expertise and your knowledge in such an accessible way. So thank you very much.
Thanks.
Thank you, Sunita.
Thanks.